Did you know that your blood sugar could be rising every day without you eating anything wrong and without your body giving a single warning sign? This happens to millions of people over 60, and the most common cause is a habit so simple that no one suspects it. I know how much this fear of losing control over your own health weighs on you, but there is a real science-based solution within anyone's reach. I'm Dr. Kevin Vries, and today I'm going to show you exactly what to do. The silent habit that sabotages blood sugar. There's a habit I see repeated in my office with a frequency that truly worries me. The person wakes up, goes straight to the coffee machine, has their first cup on an empty stomach, without drinking a single drop of water, and goes about their day thinking they're starting off right. It seems harmless. It even seems healthy. But what happens inside the body at that moment is the opposite of what most people imagine. Caffeine, when it enters the body on an empty stomach, triggers the adrenal glands, which are the glands responsible for releasing cortisol, the stress hormone. Think of it this way. It's as if your body receives a warning signal first thing in the morning, even before you face any challenges of the day. And when cortisol rises, the liver interprets this as an emergency and starts releasing stored glucose directly into the blood. In other words, your blood glucose is already rising before you put any food in your mouth. I see people who take medication to control their blood sugar, follow a diet, avoid sweets, and still come in with altered test results. When we investigate their routine, this same pattern almost always appears. Coffee on an empty stomach, without water, right after waking up. The detail that almost no one notices is that the body has already spent the entire night in a state of deprivation. It is dehydrated, with a slowed metabolism and hormonal systems readjusting. Giving it caffeine at this moment is like throwing fuel on a fire that has not yet been controlled. The result is a glucose spike that happens silently, without pain, without immediate symptoms, but which over time accumulates damage. This is the kind of sabotage that no one talks about because no one associates morning coffee with a blood sugar problem. The silent epidemic of diabetes in Brazil. 20 million Brazilians live with diabetes today. 20 million. And more than half of the people with the disease worldwide have not yet been diagnosed. This is not a cold statistic. These are people who wake up every day not knowing that their own bodies are being silently destroyed from within. What deeply disturbs me in this scenario is this. Among people over 65, more than 1 in 3 already have out-of-control glucose levels. It's not a minority. It's almost half of your generation. And the fastest growing type 2 diabetes, doesn't come from pure genetic inheritance. It comes from lifestyle, from diet, from a sedentary lifestyle, from years of habits that the body has accumulated without giving clear signs of protest. I see this in my clinical practice with a regularity that is tiresomely concerning. A person comes in for a routine exam with no specific complaints, and there it is, sky-high glucose. They look at me, astonished, and say, "But I don't feel anything, doctor." And that's exactly the problem. Type 2 diabetes acts in silence for years before it appears with full force, when it has already left its mark on the kidneys, eyes, arteries, and nerves. Here's a detail that almost no one notices. The body can compensate for excess blood sugar for a long time. It works like a dam that fills up slowly. From the outside, it looks calm. Inside, the pressure builds. And when it breaks, the damage is already done. Knowing that this epidemic exists and that it is within your age group is not a reason to panic. It is a reason for real, concrete, and immediate attention. Vasopressin, the hormone that raises glucose. There is a mechanism inside your body that very few people know about, and it may be raising your glucose even without you eating anything different. It has an unfamiliar name, vasopressin. But what it does, when activated, completely changes how you see the risk of diabetes. Vasopressin is produced by the brain whenever the body detects a lack of water. It kicks in to retain as much fluid as possible in the kidneys, as if the body were turning on a hydraulic emergency signal. But this same hormone also sends a direct order to the liver: release more glucose into the bloodstream. The two commands arrive together in the same package. Here's a detail that almost no one notices. Mild chronic dehydration, the kind that doesn't cause strong thirst or dizziness, silently activates this cycle throughout the day. A patient of mine, a 63-year-old man, came in with unstable blood glucose without any change in his diet. When we investigated his routine, his water intake was barely half a liter a day. A French study followed over 3,600 people and found something that cannot be ignored. Those who drank less than a liter of water daily had a significantly higher risk of developing type 2 diabetes. This is real clinical data, not speculation. What this translates to in practice is that hydration is not just about quenching thirst. It is part of the hormonal regulation that controls blood sugar. When this balance is broken, the price is paid in silence. Dehydration concentrates blood sugar. Human blood has a very precise composition. When the water that keeps it fluid begins to run low, it literally thickens, like a broth that stays on the fire for too long and loses volume. The sugar that was already circulating in it doesn't disappear, it simply becomes concentrated in a smaller space. And the direct result of this is higher blood glucose without you having eaten a single extra gram of carbohydrate. I see this in my practice with a regularity that honestly still impresses me. Insulin, which already works with difficulty in people over 50, starts to face a disproportionate volume of glucose for what it can process at that moment. It's like asking a person to carry twice the weight with the same arms. The system can't handle it, and the glucose rises. What makes this even more worrying is a detail that almost no one considers. After the age of 50, the brain's thirst mechanism loses sensitivity. The person simply doesn't feel thirsty the way they should. They don't drink water because the body doesn't send the correct signal, and they go on living in a state of chronic dehydration without realizing it. I have treated patients who went the whole day with less than a liter of water, thinking they were fine, while their blood glucose rose without any apparent explanation. This silent dehydration acts from the inside without giving a clear warning. It doesn't hurt. It doesn't show in the mirror. It doesn't generate an obvious symptom that makes a person stop and think. And that is precisely why it settles in, remains, and erodes glycemic control day after day, week after week. Mistake 1. Drinking water. Only when you feel thirsty. Trusting thirst as a guide for hydration seems completely logical. The body asks, you provide. But this reasoning has a serious clinical flaw that is well worth understanding. Thirst is not an early warning, it's a late signal. When your mouth gets dry and that urge to drink appears, your body has already lost about 2% of the water it needs to function correctly. It seems like a small amount, but in the human body, such a variation is already enough to trigger an emergency process. This process begins with a hormone called vasopressin. To simplify, imagine that vasopressin is like an internal alarm that goes off when the body detects a lack of water. And when this alarm is activated, one of the body's responses is to order the liver to release extra glucose into the bloodstream. Here's a detail that almost no one notices. If you live waiting to feel thirsty to drink water, your body is periodically entering this alert mode. And in this mode, the liver responds by releasing glucose, even if you haven't eaten anything wrong, even if your diet is in order. I see this in patients who make a genuine effort to take care of their health, control their sweets, avoid ultra-processed foods, but who drink water reactively only when they feel the sensation of thirst. The result appears in their tests: elevated glucose without a clear dietary cause. And the explanation lies precisely in this cycle of repeated dehydration. Hydration needs to function as prevention, not as a response. By the time the body is already asking, the process has already begun. Mistake 2. Drinking large volumes at once. Drinking a lot of water at once seems to solve the problem. You go for hours without remembering, feel your mouth dry, go to the kitchen and drink a large glass all at once, maybe 2, and you feel like you're making up for lost time. But your body doesn't work that way, and this misunderstanding is more harmful than most people imagine. The body can absorb, at most, between 200 and 250 milliliters of water every 15 minutes. That's less than a full standard glass. When you drink half a liter at once, what exceeds this capacity doesn't go to your cells. It goes straight to your bladder. It is eliminated before it even has time to do any good. I've seen this happen with patients who told me, with complete confidence, that they drank 2 liters a day. When I asked how they drank it, the answer was always the same. In 3 or 4 sittings, in large volumes. They were hydrating on paper. In practice, a good part of that water was being discarded without serving any function. Here's a detail that almost no one notices. The cell cannot absorb water at an industrial speed. It needs time. Hydration that arrives slowly and continuously throughout the day is what really penetrates the tissues, lubricates the joints, regulates temperature, and maintains organ function. The water that arrives all at once in excess overloads the kidneys and bypasses the cells that need it most. What solves this is not willpower or grand gestures. It's distributing small amounts throughout the entire day, respecting the body's natural rhythm. Mistake 3. Cold water harms insulin. Here is a detail that seems small, but which I see causing a real interference in the glycemic control of many people. The temperature of the water you drink. It's not about quantity. It's not about the time. It's about what happens inside your vessels when cold water enters. When the body receives a very cold liquid, it responds with vasoconstriction. In other words, the blood vessels contract. They become narrower, like a hose being squeezed in the middle. And what circulates through these vessels? Glucose, insulin. The two elements that need to work together to keep blood sugar under control. I see this happen in practice. A person follows the treatment, takes the medication, eats carefully, but the results are still below expectations. And when we investigate the details of their day-to-day life, the cold bottle is there, always by their side. Insulin has a very specific function. It works like a key that opens the cells to receive glucose. But if the vessels are constricted, this key doesn't get where it needs to go. Efficiency drops, and the glucose circulates for longer than it should. The ideal temperature for hydration is between 20 degrees C and 24 degrees C, 72 degrees C and 75 degrees C, that is, room temperature or slightly warm. It doesn't need to be hot, it just can't be ice cold. This adjustment, as small as it may seem, changes the body's internal condition in a way that tests, sooner or later, will show. Pillar 1. The morning ritual with water and salt. The first few minutes after you open your eyes are more decisive for your glucose than any meal of the day. The body wakes up in a state of natural alertness, and in this process, cortisol, the stress hormone, already starts to rise. This morning increase sends a direct signal to the liver to release glucose into the blood. Blood sugar rises before you even take a sip of coffee or eat anything. What changes this pattern is something surprisingly simple. 300 to 350 ml of warm water with a pinch of unrefined sea salt taken before any food. Not the industrialized white table salt, but whole salt, which still carries sodium, potassium, and magnesium in its composition. These minerals work together to soften the cortisol spike, directly reducing this silent glucose surge that happens every morning with or without a diabetes diagnosis. Stay with me here, because what comes next is what turns this habit into something strategic. Right after waking up, the body's sensitivity to insulin is at its highest point of the entire day. It's as if the cells have their doors more open, more receptive. Taking advantage of this moment with the right hydration is putting your metabolism in your favor from the start, before anything interferes. I see this in my practice. Patients who incorporate this ritual report more stable fasting blood sugar and less tension upon waking. The body responds when you offer what it needs at the right time. Pillar 2. Water. 15 minutes before meals. 15 minutes. It seems like a simple, almost trivial wait. But this interval, placed between you and your plate, can completely change how your body processes what you are about to eat. And I'm not talking about a distant theory. I'm talking about something I guide in practice for patients with a history of high glucose, and that produces visible results in a short time. Before each meal, about 150 milliliters of water, equivalent to a small glass, should be drunk 15 minutes in advance. Not during the meal, not after, before. This timing detail is what makes all the difference. When water reaches the stomach before food, it activates digestive enzymes and slightly dilutes the gastric juices. The practical result is that the absorption of carbohydrates becomes slower, more gradual, and less aggressive for the pancreas. Let me explain what happens when this doesn't occur. You sit at the table, eat normally, and in less than an hour, the glucose in your blood spikes. The pancreas goes into emergency mode to release enough insulin. Over time, this cycle of overload wears down this organ silently, without pain, without warning, without a clear sign that something is running out. A patient I've been following for a few years always thought the problem was what she ate. When she started including this glass of water before meals, her spikes dropped consistently, without any other change in her diet. Sometimes the body needs preparation, not restriction. It's not just about drinking more water throughout the day. It's about the right moment. The water before the meal is a warning that the digestive system receives in advance, and when well prepared, the body responds with much more balance. Pillar 3. Hydration. During movement and the power of cinnamon. When the body is in motion, the rules change. What works while sitting at a table is not enough when the muscles are working and the metabolism is at a different speed. And that's exactly where I see many people make a silent mistake, waiting for thirst to appear to drink water during exercise. Thirst during physical exertion is already a late signal. When it arrives, you already have a water deficit, and this deficit directly interferes with how glucose circulates and is used by the cells. The blood becomes thicker, circulation slows down, and the body starts working against itself, right when it needs efficiency the most. The guidance I give in clinical practice is direct. For every 15 minutes of physical activity, drink between 100 and 120 milliliters of water. Not a full glass at once, not a symbolic sip. A small, regular amount that maintains internal balance without overloading the stomach. But stay with me, because there's a detail within this protocol that enhances everything. A pinch of cinnamon powder dissolved in the bottle. It seems too simple to make a real difference, but cinnamon acts on the metabolism as a natural insulin sensitizer. It helps the cells recognize the hormonal signal more easily, facilitating the entry of glucose into the muscle tissue being used. The mechanism is similar to what magnesium does, but through the path of flavor and habit. When the two work together, the result is a more favorable metabolic environment during movement, with less glucose left in the bloodstream and more energy available for the effort. Pillar 4. The nightly glass with magnesium. Something is happening to your body while you sleep that most people never associate with the next morning's glucose level. When you go to bed dehydrated, the body interprets this as a threat. That's not an exaggeration. It's basic survival biology. Without enough water, the body triggers a state of alert, releases stress hormones, and these hormones do exactly what you don't want them to do during the night. They raise blood glucose. Then you wake up, do the fasting test, and the number is high. And often the blame wasn't yesterday's dinner. It was the silent dehydration of the night. I see this pattern in my practice frequently. The person is following the diet, controlling their sugar, but the morning fast remains unstable. When we start looking at their nighttime habits, the answer appears. A glass of warm water, about 250 milliliters, taken about 20 minutes before bed, already makes a measurable difference. Warm water is important here because it doesn't cause contraction or digestive overload. It is absorbed more easily and helps the body maintain balance without triggering compensatory mechanisms. Stay with me, because what comes next completes this strategy in a way that the numbers confirm. The combination of the nightly glass with magnesium, especially in the forms of citrate or bisglycinate, showed a significant reduction in fasting glucose levels in a meta-analysis that gathered 13 clinical studies. Magnesium is directly involved in how insulin works in the cells. When it is lacking, and many people over 50 have a deficiency without knowing it, insulin signaling is compromised, and glycemic control worsens even with an adjusted diet. The dose that appears in studies is around 200 milligrams, always under medical guidance, because the form of magnesium and the dosage need to be adjusted for each organism. It is not a supplement you simply add on your own. But when indicated correctly, it acts as a silent support for the metabolism during sleep, exactly when the body is reorganizing for the next day. The nightly glass, done the right way, can be one of the simplest and most effective gestures in the entire routine. The personalized hydration formula. The 8 glasses a day rule is one of the most repeated health guidelines and also one of the most inaccurate. It doesn't take into account your weight, your routine, or the temperature of the day. Following this number as if it were law can leave you either dehydrated or ingesting more water than your body needs. What physiology supports and what I apply in my practice is a simple formula. Multiply your weight in kilograms by 30 milliliters. A 70 kilo, 154 lb person needs approximately 2100 millimil, 71 Oz per day, a little over 2 liters. This number already represents a much fairer starting point for your specific body. But whenever you move more intensely, add between 400 and 500 milliliters, 13-17 Oz, for each hour of physical activity. The effort accelerates fluid loss through sweat and increased respiration. Ignoring this compensation is one of the most common reasons why active people end the day with signs of dehydration without being able to identify the cause. And here's a detail that is worth more than any calculation: the color of your urine. It is the most honest indicator your body offers throughout the day. Light yellow, almost transparent, means your hydration is adequate. Dark yellow signals that you are already in deficit. Over the age of 50, thirst appears late, when the body is already suffering the consequences. Therefore, do not wait for the signal of thirst. Observe the color of your urine as if it were a control panel. It's simple, free, and available all day long. The villain in disguise: diet and zero-calorie soda. Switching from regular soda to diet seems, at first glance, like a smart choice. And for years, that's exactly how this drink was sold, as the responsible version, the choice for those who take care of their health. The problem is that some of the worst traps come disguised as a conscious choice. Conventional soda causes a violent glucose spike, and that is already widely known. But diet soda acts more silently and therefore more dangerously. These drinks are rich in phosphorus, which in excess competes directly with magnesium in your body, blocking the absorption of this mineral. Think of it this way: it's as if phosphorus comes pushing in line and prevents magnesium from entering, and magnesium is essential for glucose control, muscle function, and sleep quality. Even if you eat well, this blockage happens without you noticing. What comes next may surprise you. The artificial sweeteners present in diet and zero-calorie sodas do not raise glucose directly. That's true. But they mess with the gut microbiota, which is the community of microorganisms that lives in your intestine and has a direct influence on how your body responds to glucose. Throughout my clinical practice, I have followed patients who completely cut out sugar, adopted diet soda with conviction, and yet continued to have difficulties with glycemic control. The unbalanced microbiota was standing in the way. The alternative is simpler than it seems: sparkling water with a little lemon, ginger, or mint. You're not just switching a drink, you are removing a real interference that was silently working against you. Magnesium, the forgotten mineral in diabetes. There is a mineral that lives inside your body performing a silent and indispensable job, and that almost no one notices when it starts to run low. This mineral is magnesium. And if you live with diabetes, what I am about to explain may change the way you understand your own condition. Over more than 15 years of caring for patients with metabolic disorders, I began to notice a pattern. People who followed their diet, took their medication, and still couldn't stabilize their glucose. And in many of these cases, when we investigated further, their magnesium was low. Not dramatically low, but enough to compromise entire systems. Magnesium is involved in more than 300 chemical reactions happening inside you right now. It is at the center of the processes that control how insulin does its job. Insulin is the key that opens cells to receive glucose. Magnesium is what ensures that this lock works properly. When it is lacking, insulin loses efficiency. Glucose becomes difficult to control, not because you made a mistake in your diet, but because the internal mechanism is missing a part. And diabetes makes it worse. Excess sugar in the blood accelerates the elimination of magnesium through the kidneys. High glucose reduces magnesium, and low magnesium makes it difficult to control glucose, a cycle that feeds itself in silence. Identifying and correcting this deficiency, always with medical guidance, can produce real and measurable changes in diabetes control. It's not a vague promise, it's biochemistry. If you've made it this far, you know more about your body than most doctors have told you in a 10-minute consultation. And the first step starts today. When you wake up tomorrow, before your coffee, drink 300 ml of warm water with a pinch of sea salt. Just that. A simple gesture that already changes your body's internal environment from the first hour of the day. Tell me here in the comments, did you already know that dehydration raises blood sugar, or was this a revelation for you today? And if this content made sense to you, subscribe to the channel. This is where I bring every week what science shows and the clinic confirms. Take good care of yourself. Take good care of the ones you love.